Good afternoon, my name's Trista, and I'm here to talk to you about pneumonia today. Pneumonia can be fatal in up to 30% of severe cases. In fact, pneumonia kills more children than any other infectious disease. What's pneumonia, you ask? Well, pneumonia is an infection that causes inflammation to the air sacs called alveoli to either one or both of the lungs. Classification of the type of pneumonia is according to the causative agent. Now, bacteria, viruses, and even sometimes fungi from the upper airways, or less commonly from the blood, they find their way to the lung tissue. Once the offending agent arrives, a combination of factors, including the virulence of the infecting organisms, status of the local defenses, and the overall health of the patient, may lead to pneumonia. The causes for development of pneumonia are either extrinsic or intrinsic. Extrinsic factors include pulmonary injury, exposure to pulmonary irritants, or the causative agent. Intrinsic factors are related to the host. For example, loss of a protective airway reflex allows aspiration of contents from the upper airways into the lung. That would be intrinsic factor. As germs invade and multiply within the lungs, white blood cells rapidly accumulate to destroy the attacking organisms. These white blood cells, along with bacteria or fungi, begin to fill the alveoli within the lungs. Pneumonia can affect anyone. However, there's two age groups most at risk, and those are under the age of 2 or older than 65. Other risk factors include being hospitalized, chronic diseases such as COPD, asthma, diabetes, chronic heart conditions. Smoking damages the body's natural defenses against bacteria and viruses that can cause pneumonia. Those with a weakened or a suppressed immune system, including those with HIV, AIDS, if you've recently had an organ transplant, if you're taking long-term steroids, chemotherapy. There may be other predisposing factors, conditions that interfere with the normal drainage of the lung, such as general anesthesia, post-op immobility, or even central nervous depression from drugs. All of these can interfere with the drainage of the lung. Pneumonia can be classified into 3 groups. Community-acquired is the most common type of pneumonia. It occurs outside of hospitals or other healthcare settings. Pneumonia may be caused by bacteria. The most common cause of bacterial pneumonia in the U.S. is Streptococcus pneumoniae. This type of pneumonia may occur after a cold or the flu, but it may also occur on its own. Bacterial-like organisms such as Mycoplasma pneumoniae can also cause pneumonia, but generally has milder symptoms than other types of pneumonia. Fungi. This type of pneumonia is most common in those with chronic health conditions or weakened immune systems. The fungi is found in soil or bird droppings, and when inhaled in large doses may cause pneumonia. Viruses, including COVID-19. Viruses are the most common cause of pneumonia in children younger than 5 years of age. Viral pneumonia is usually mild, but may become serious. COVID-19 may result in a severe pneumonia. Nosocomial pneumonia is pneumonia that's acquired in the hospital or long-term care setting or outpatient clinics such as kidney dialysis centers. These pneumonias are caused by bacteria that are more resistant to antibiotics, primarily gram-negative bacilli and staphylococci. Atypical pneumonia may be caused by Legionella, Mycobacterium pneumoniae, or Chlamydia pneumoniae. There is also another type of pneumonia called aspirational pneumonia, which is caused from inhalation of food, drink, saliva, or vomit into the lungs. Aspiration is more likely in stroke patients or those whose normal gag reflex is disturbed. Clinical signs and symptoms include shortness of breath, nausea, vomiting, diarrhea, coughing, fever, chills, fatigue, chest pain, especially during coughing, confusion or mental status changes in those 65 or older. Cough may be productive or non-productive. In order to definitively diagnose pneumonia, in addition to doing a full head-to-toe body assessment, auscultating the lungs, the physician may order diagnostic testing. It may include a chest x-ray. Chest x-ray can show consolidation or infiltrate. However, it cannot determine what germ is causing the pneumonia. In order to determine the cause of the pneumonia, a blood test and or a sputum culture may be used. These tests will help the physician determine which antibiotics will treat the infection. Additional testing, such as a CT scan or a pleural fluid culture, may be utilized if your pneumonia is not getting better or if there's other serious health conditions or symptoms present. Complications can arise from pneumonia, such as bacteremia. When bacteria enters the bloodstream, infection can spread to other organs, causing organ failure. Lung abscesses can form if pus forms in a cavity of the lung. Pleural effusion, which is a buildup of fluid in the lining between the wall chest cavity and the lung. Difficulty breathing and maintaining oxygenation. If this happens and it is too severe, a ventilator may be necessary. Antibiotics, as previously discussed, should ideally be tailored to the specific organism. The most commonly used antibiotic for community-acquired pneumonia are penicillin-based. If penicillin-resistant, ceftriaxone or fluoroquinolone may be prescribed. Levofloxacin or third-generation cephalosporins may be used for nosocomial-acquired pneumonias, and atypical pneumonias are most commonly treated with fluoroquinolones. Fever reducers and pain relievers can be taken as needed for fever and discomfort. These include Tylenol, Advil, Motrin, among others. Supportive therapy can help patients recover more quickly, ease discomfort, and lower the risk of complications. So it's very important to get plenty of rest, stay hydrated to help loosen and thin secretions, and not exert oneself too soon. Supplemental oxygen if necessary, frequent turning and repositioning, maintaining an upright position to promote lung expansion. All of these will help your patient. And we can't forget to, lastly, educate. We need to educate the patient to complete their entire course of antibiotics. They need to be practicing good hand hygiene, avoid fatigue, gradually increase their activity, don't just jump right back into it, proper hydration. We need to demonstrate deep breathing to our patients. You want to place your hand on your abdomen and take a deep breath. Hold for 3 seconds and then cough 2 to 3 times forcefully. If anything comes up, it needs to be spit into a tissue and discarded appropriately. We need to advise smoking cessation to our patients if necessary. And we also need to educate, if indicated, on the pneumococcal vaccination. These are all things that you can do to help your patient recover more quickly. There's also incentive spirometers that some hospitals and doctors' offices have that you can teach your patient how to use. There's all kinds of things that we can do intervention-wise to help our patients. Lastly, I'd like to show you my display here. There's some pictures of some lungs. And of course I have my levofloxacin and my little model here. Thank you guys for letting me talk to you today about pneumonia, and feel free to reach me at the local health department if you have any questions.